Hi, welcome to this lecture on traditional medicine poisoning, which I'll be taking from a Zimbabwean context. So, the objectives of today's talk are to provide a toxicological perspective to the use of traditional medicines slash medicinal plants in Zimbabwe, and then also to provide insights on the clinical presentation and management of traditional medicine poisoning in Zimbabwe, based on literature as well as experience that we have had from a poison center perspective. All right, so moving right on. So traditional medical practice is quite synonymous, with most cultures on the African continent. Not only on the African continent, but also elsewhere in the world. And here we're talking about, traditional medical practice which uses natural products. And the natural products which are used in traditional medical practice, they actually vary from plant materials, for example, Biden's pilosa, which is known as mutsine in Shona, which has been used for a variety of medical conditions, including, inflammatory conditions, to the use of insects, like here, if you see on the right bottom part of the picture, we have got insects which belong to the Milebris species, which contain cantharidin, which have been used as aphrodisiacs in Zimbabwe as well as other parts of southern Africa. But also some other materials are used apart from plant materials and insects. For example, elephant dung, which is believed to assist pregnant women in giving birth, as well as some other compounds of mineral origin. So, as we're moving on, it might be a good idea, perhaps at this point, if students are going through these slides as in groups, or even by yourself, to just ask yourself, that in your experience, in your practice, what other non-plant materials are you aware of which have been used in traditional medical practice? And if you've got your course guides, it would be a good idea right now to actually jot these things down, as they'll be useful to you sometime in the future. So the reason why traditional medicine practice in Zimbabwe as well as other parts of Africa continues to be quite important, it's largely because, number one, of the deep-set traditional beliefs that we have in the efficacy of these plants and of traditional medical practice. In addition, in many parts of the world, including in Africa, traditional medicines actually offer cheaper alternatives to orthodox medicines, which can actually be beyond the reach of many people in the rural areas. In addition, linked to that, whereas when you go to a pharmacy, you need to use actual cash or money or do a bank transfer. With traditional medical practice, patients can actually pay in kind. For example, they could bring a chicken, they could bring a goat or some other animal or some other way which the traditional medical practitioner can be able to accept as payment. And therefore, traditional medical practice continues to be quite important in our parts of the world. And then the third reason is generally, there's this general belief that, natural is viewed as safe. And many people believe that, things which are from natural origin, be it from plants or otherwise, are generally safe compared to these synthetic compounds that we have as medicines. So I've just put something which I've labeled a quick talk, just to assist listeners and students to think through some of the issues. For example, I said in this particular slide, are there any other reasons why people would prefer visiting a traditional medical doctor to a Western doctor that students can think about? And if there are, just note them down in your course guide or discuss them with a colleague or a friend. So having said that, in developing countries, a large proportion of the populace continues to rely on natural products to meet their healthcare needs. And this is from a study which was published by the World Health Organization. And interestingly, The developed world seems also to be moving towards that direction, where there's a cultural renaissance towards more natural methods of healing, including natural products. And we see this, with a number of complementary medicines now being given marketing authorization in many developed countries. Also, people seem to be turning to alternative and complementary medicine generally. But the question then comes, do traditional medicines really work? Do these medicinal plants really work? Well, for some of the plants which are used, for example, St. John's wort, or in the case of the cinchona alkaloids or salicylates, scientific experiments have actually demonstrated the efficacy with these plants. And in the case of salicylates, we have our aspirin, which in essence was in quotes derived from a plant. And then cinchona alkaloids, we know about the cinchona alkaloids, which have also given rise to anti-malarial drugs. So yeah, we do have evidence that plants actually do work, some of them, but it's not necessarily all of them. And therefore, for some of the others, well, we can't really be too sure. A classical example that we have here in Zimbabwe is a stone, which is referred to as black stone, which is supposedly an effective remedy in the management of snakebite. But really, the truth of the matter is that you cannot prove this scientifically. It has not been proved scientifically, and generally, concerning traditional medicines, there's been none which has been shown to have efficacy, at least from a scientific perspective, with regards to management of snakebite. And then another important thing to take into consideration when we're talking about whether traditional medicines work or not is the issue of adulteration. When you go into the streets of Harare, you find a large number of, in quotes, traditional medical practitioners, or should we say vendors of the so-called traditional medicines seated in the streets of Harare. And sometimes some of the plants which they sell are adulterated with orthodox medicines. In fact, we did a study some years ago where we took some traditional medicines. A student went around asking for traditional medicines, to buy traditional medicines for a headache. And it was interesting to find that actually a number of the samples that we got were actually laced or adulterated with paracetamol. Meaning that maybe the people knew that it would work, but really the active ingredient which was working was not the traditional herb itself, but was paracetamol. Some have argued, though, that, well, maybe the vendors or the traditional medical practitioners added the paracetamol for the sake of a synergistic or additive effect. But, well, I don't know. Highly questionable. When you look at Zimbabwe, apparently there is actually significant use of herbal products or traditional medicines in HIV-infected patients. Mujiti and colleagues did an interesting study in 2012 where out of patients whom they interviewed who were HIV-infected, 98.2% of the patients were interviewed agreed or admitted that they were taking at least one herb from the various herbs that we have in Zimbabwe. And that's a pretty high percentage. From the study by Mujiti and colleagues, Allium sativum was actually right at the top, and that's organic, accounting for 72.7%. And then close to it was Biden's pilosa, which is actually used quite extensively in local traditional medical practice. 66% of the patients, agreeing or admitting to using Biden's pilosa. And then we had the Eucalyptus globules accounting for 52.3%, and Lippia Javanica, about 36.3% of the patients said that they were taking the plant. And this is quite a fascinating plant because we actually saw it also coming to the forefront during the COVID crisis, which we had, the global COVID crisis. But here in Zimbabwe, the plant was quite extensively used in our own local traditional medical systems. And Peltoforum africanum accounting for 34.3%. And I think this is one of the plants which may actually have salicylates in them. So having said that, I just want to address two main misconceptions which lay people, and I've put in quotes, some scientists, put across with regards to medicinal plants or traditional medicines. The first misconception is that all natural products are safe, or that just because something is natural, it's safe, or that natural means safe. That's number one. Then the second misconception which we see out there is that there's a misconception that just because a plant has been used for a long period of time traditionally, without any reported adverse effects, and in this case, it's ordinarily referring to acute adverse effects. Therefore, the assumption is that that plant is actually safe. And what I want you to think about before I move on is to say, okay, are these fair assumptions? Do you think that all natural products are safe? And secondly, do you think that just because a plant has been used for a significantly long period of time, therefore that plant is also safe? And are there any other misconceptions that you have come across? Be it in your practice, if you're someone who's doing the MSc Clinical Pharmacology course, or perhaps in your experience or you've heard about. The truth really is actually quite far from it. And actually, most acutely toxic substances that are known to men are actually of natural origin. For example, I have here a picture of Abrus precatorius, and this bean, which is red and black, actually contains one of the most toxic substances known to men in terms of potency, known as abrin. And earlier, I showed you a picture of the blister beetles, and blister beetles contain a substance known as cantharidin, both of which are highly toxic substances. So really, it is a misconception. Moving on, I'll give you another example. This is Ricinus Communis, which also contains one of the most toxic substances known to human beings, known as ricin. And I think you will remember from your introduction to toxicology lectures the story about Georgy Markov, the one who was assassinated after being hit by a small dart which had ricin from it. And that ricin is actually extracted or can be extracted from this Ricinus communis. And we have another beautiful plant, Nerium oleander. So here is the pink substances are poisons. That there is none which is not a poison, and that the right dose differentiates a poison from a remedy. And that's something always to keep at the back of our mind. So having said that, what is the picture that we have on the ground with regards to traditional medicine poisoning in the country? So a number of toxico-epidemiological studies have been done in Zimbabwe, about 3 or 4 major ones. The first one, which was done by Castillo and Nachi and reported in 1992, actually put forward results that showed that traditional medicine poisoning was actually the highest cause of admission due to poisoning back then. Some authors have argued that, in cases where someone was poisoned and the culprit agent was not known, the doctors or whoever was in attendance would just basically refer to that as multi-poisoning or traditional medicine poisoning, and therefore that the results of this may not be accurate. Taguire and colleagues did a follow-up study about 10 years later, and from their study they found that the case fatality rate from traditional medicine poisoning admissions to major referral hospitals in the country was about 10%, which is pretty significant. And therefore, toxicologically, traditional medicines are important, and assuming that they are all safe perhaps might not be the best of assumptions that we should make. At this point, I would like to refer students to three main papers. The first one is a paper published by Tagwire and colleagues in 2002, which looked at multi-poisoning in Zimbabwe and basically looked at the patterns of poisoning as well as the clinical symptoms of poisoning at Parinyato Hospital, which is one of the major referral centers that we have in the country. The other paper, which is required reading for everyone taking up this course, is the paper by Tagwire and colleagues, again published in 2002, which looked at traditional medicine and poisoning in Zimbabwe with a focus on clinical presentation as well as management in adults. And some of the issues raised from these papers we shall discuss before the end of this lecture. And then one other paper that students ought to look at is another paper by Tagwire and colleagues. This one was published in the journal Toxicon in 2000 and basically gave an account of cantharidin poisoning due to blister beetle ingestion, where 4 children ingested some blister beetles after frying them, perhaps mistaking them for the edible Eucalyptus mashona beetles that we have here in Zimbabwe. So having said that, we just want to quickly look at some of the reasons why traditional medicine poisoning can occur. So one of the most cited reasons why traditional medicine poisoning can occur is that the doses really are rarely rationalized for age and weight. And ordinarily, you'd just be told blanket statements like, give a cup, and this is regardless of whether a patient is 50 years old or a patient is 20 years old or a patient weighs 50 kilograms versus one who weighs 100 kgs. And therefore, you can actually expose some of the patients who are at risk to much higher doses of the traditional medicine, which could result in toxicity. Sometimes traditional medicine poisoning occurs as a result of the use of incorrect herbs, especially when people are doing self-therapy. And we saw a lot of this during the COVID era, where people who did not know, Lippia Javanica would make a mistake and instead, pick on Lantana camara, which might have some white leaves. And there was 1 or 2 cases where there were some toxicological effects which resulted in hepatotoxicity and renal toxicity. So sometimes somebody thinks that they know a certain plant, but make a mistake and then pick up an incorrect plant in the process. Also, sometimes poisoning can occur as a result of vague instructions. If you're told, put 1 cup of this plant in porridge, but really, what is a cup? Is that a coffee cup? Is that a tea cup? Is that a huge coffee mug like the one that my wife likes? What is the definition? And because of this, you see, then it is possible then to get exposed to much higher doses than other people. And sometimes there could be a risk actually of interactions with orthodox medicines. For example, we do know that some other plants like Securidaca pendiculata has got salicylates. And if someone is exposed to salicylates, maybe they are taking aspirin, and then in addition they also take this particular plant, you could get an increase in salicylate levels and therefore suffer from poisoning. And it could be the other way around, where the plant might have some inhibitory activity, perhaps leading to an increase in cytochrome P450 enzymes, which therefore reduce the efficacy of other drugs, leading to adverse effects, not necessarily poisoning, but adverse effects nonetheless. And sometimes traditional medicine poisoning can occur because of malicious use, where somebody knows that the plant is toxic and they intentionally give that toxic plant to somebody else, whether for witchcraft or perhaps to try and eliminate them. And poisoning has been known, traditional medicine poisoning has been known to occur in some patients who try to take their own lives by using medicines that they know are actually quite toxic. And there could be other reasons. For example, even using the medicines which a herbalist has given to you incorrectly, not listening to the instructions, ultimately resulting in poisoning. So concerning traditional medicines here in Zimbabwe, where do people get these medicines from? Well, just like we saw in the COVID era, a number of people went about picking up the plants for themselves. And this can cause a risk in cases where the patient might not actually know exactly what the plant looks like. And other people go to a local traditional healer. And at this point, it's important to note that in Zimbabwe, we've got a number, different types of traditional healers. We've got spiritualists or spiritual healers, and these ones might, talk about how they found out from the spirit realm what plants to give to their patients, and they might have a mix, of the spiritual issues as well as the herbs or plants that they're using. But we've got some who are really purely herbalists, who are those who have been trained perhaps by their fathers or grandfathers, and this information has been passed on from generation to generation. We can also get traditional medicines from some marketplaces. For example, you go to Narambaro, you get the medicines being sold to you. Sometimes traditional medicines can be obtained from friends or relatives or somebody who claims that they know about the medicines. Concerning purely traditional medicines here in Zimbabwe, we rarely, if at all, find them being sold in pharmacies. Because really what you should have in pharmacies are plants which have been approved by the local drug regulator. And people can get them from other sources that you can probably think about. So, what are the routes of administration with regards to traditional medicines? So the routes, they really vary and include oral ingestion, which is perhaps the most common route that we know of. You can have topical applications, and these topical applications can be with or without some little incisions which are made using a razor blade, which is known in Shona as kutemanyora, where little incisions are put on the skin and the traditional medicine is actually rubbed onto the skin. It could be inhalation, which is one of the significant methods of use, especially in children, also known as kunatira in Shona, and we used to call it ukutunisela in isiNdebele. And this inhalation route was used a lot during the COVID crisis, where people would burn, boil maybe Lippia Javanica, and then put a blanket over and get somebody to just, inhale the fumes. And incision and rubbing of herbs I've talked about, but it could also be the rectal, like if you see this little picture here, the young child is being given a herb through the rectal route, or it could be via a vaginal route. And it could be through other routes, for example, into the eyes, through the nose, all different routes. But hardly or rarely do we find the traditional medicines, being given intravenously. So, somebody has been poisoned by a traditional medicine. How do we then identify which substances is involved? So the identification of traditional medicines involved in poisoning is often quite difficult, very difficult task, and it's because of a number of things. Number one, some patients may actually not know what they took, and all that they have are these crushed herbs which they give to you. They have no idea exactly what plant it is. Unlike perhaps in orthodox medicine, where if somebody takes an overdose of a drug or if a drug makes them ill, they can come with a package insert or with the packet where the drug was dispensed from the pharmacy, and you can actually read and see what is the cause and perhaps take whatever necessary action. With traditional medicines, this is actually quite rare, as they are often not labeled but are just given to the patients as they are. So the patient might not know what they took. And then also, the concoctions are usually mixtures of several herbs. So it makes it very difficult to actually know which one of the herb was responsible for the toxic effects being seen. Maybe there's a synergistic effect. Maybe there's some potentiation which is occurring. Maybe there's an additive effect which is actually occurring. And another thing is that patients are often reluctant to disclose the fact that they've taken traditional medicines. So even if somebody's been poisoned by traditional medicine and you ask them, hey, what did you take? In some instances, they will not even be in a position to want to disclose the fact that they took traditional medicines because of the way that they feel that society might actually view them. Again, another issue is that traditional medical practitioners are often reluctant to identify the medicines in quotes or the plants that they use, and these are normally closely guarded secrets. For many feel that the knowledge might be taken away by somebody, and somebody will become a millionaire using their own, intellectual property or the knowledge which has been passed down. The fact that the traditional medicines are actually crushed makes it even difficult as well with regards to identification, because in order for you to identify the plant, unless it's got a very distinct smell, it becomes difficult if you've got crushed leaves or you've got a crushed bark. So then the identification becomes extremely difficult. And sometimes the identification is complicated by the fact that some of the herbs might be mixed with orthodox medicines or orthodox drugs. Like I mentioned earlier, the issue of paracetamol being laced or being used as an adulterant in some of these medicines meant for pain. So in the study by Taguirei and al., as well as other studies which have been done in Zimbabwe, traditional medicine poisoning seems to be a problem which occurs largely in males. More males poisoned by traditional medicines compared to females. At least the ones that do report to the hospitals appear to be more males. And the reasons which are associated with poisoning from traditional medicines, it's normally traditional medicine poisoning is associated with use of these medicines for aphrodisiac purposes, probably explaining why they are more males generally, as well as in quotes abdominal pains. And for abdominal pains, sometimes this could be relating to STIs. So I've put it in quotes because when you work in the public sector, you'd know that when people come sometimes and say I have abdominal pains, they might actually be talking about sexually transmitted illness, which is the other reason why people get poisoned when they use traditional medicines for sexually transmitted illness. And sometimes in females for induction of abortion. And in children, from the study done by Taguirei and colleagues, it would appear, even other studies, that traditional medicine poisoning occurs a lot in children when they use traditional medicines for a sunken fontanel, otherwise known as NOVA. So in terms of diagnosis of traditional medicine poisoning, it's quite difficult. And what makes it difficult is that patients, like we said earlier, they are often ashamed to disclose the use of traditional medicines because of the stigma associated with traditional medical use, especially in the urban areas of the country. Therefore, sometimes you can actually miss the diagnosis of traditional medicine poisoning and then, point to something else. And then one thing that you can get is that somebody can come and say that they've taken a traditional medicine and the signs that you see or the symptoms that you see appear to be as a result of the traditional medicine. But sometimes the symptoms may not be due to poisoning as such, but it could be due to someone using a traditional medicine which is ineffective. And therefore the symptoms that you see are actually symptoms of a disease condition becoming worse as opposed to poisoning. So say someone has got it as an STI, sexually transmitted illness, and they were taking a herb for it, but the herb was actually not curing it. And by the time they come, they've got abdominal pains, dysuria, maybe blood in the urine, etc. And it might lead the clinicians to say, okay, maybe it's the traditional medicine causing that. But then further inquiry could actually demonstrate that what you are seeing is the result of an STI which has not been treated for a long time actually becoming worse. I hope that makes a bit of sense. So with regards to diagnosis, the information that we get, which then leads us to the fact that somebody has been exposed to traditional medicines is normally provided by the patient relatives, or the friends. And in cases of traditional medicine poisoning, because most of the times don't really know exactly what the patient took, normal laboratory tests should be done. So your FBCs, your UNEs, what you'd ordinarily do whenever somebody's been admitted to the hospital. You could consider, looking for other substances like your salicylates in the blood. There could be some other compounds which could be found in the urine, etc. So with regards to clinical presentation, from the study done by Tagre et al., they found that the clinical presentation was quite varied when you compared children versus adults, and also when you compared males versus females. And like I said earlier, traditional medicine poisoning seems to occur more in males, adult males, compared to adult females, largely because maybe it's associated with the use of the plants as aphrodisiacs. And we know African men and their aphrodisiacs, you can't separate those two. So in children, traditional medicine poisoning normally comes as respiratory symptoms with cough, difficulty in breathing, and this could actually be related to the main route of administration of these medicines in children, which is through inhalation, like I said, kunatira. And sometimes it could also be, a number of children perhaps, are suffering actually from acute respiratory illnesses or infections. And what could actually happen is the traditional medicine is actually not working. And therefore, when the child comes to the hospital coughing, having difficulty in breathing, it's actually as a result of some pneumonia or whatever acute respiratory illness becoming worse. Acidosis has also been reported in children. And there are other various, symptoms which have also been reported depending on the traditional medicine that is taken. In adults, like I said, males are normally the culprits. The symptoms which were seen or reported by Tagre and colleagues are towards the genitourinary tract, the gastrointestinal tract, and the central nervous system, with those which are towards the genitourinary tract including hematuria, dysuria, and with increased urinary frequency and suprapubic pain, all of which could be associated with STIs, but also could be the result of traditional medicines. For example, hematuria, dysuria, in fact, all these three can also be associated with cantharidin, which is found in the blister beetle, which is actually one of the compounds which are used in the management, traditional management of erectile dysfunction here in Zimbabwe as well as other parts of Southern Africa. Symptoms also reported included abdominal pains, vomiting, and diarrhea, which are really not very specific symptoms, but could also be caused by certain plants or certain compounds. And then CNS symptoms included confusion, restlessness, unconsciousness, drowsiness, dizziness, headache. Also, not very specific symptoms, which could even, result from, dehydration, but also could be as a result of the different plants that we have. And this is just a graph, reporting or showing some of the symptoms, the clinical presentation of traditional medicine poisoning in adults is reported by Tagre and colleagues. So the target organ of toxicity with regards to traditional medicine, relating them to some of the plants that we know that the liver, there are some plants like Opuntia megacantha, which is being used in the management of diabetes in Zimbabwe and elsewhere, has been found to be hepatotoxic. The kidneys can be, nephrotoxicity could occur as a result of the Mylibris species, that's the one that contains cantharidin. Central nervous system effects could be as a result of some plants like Buffon distica, which is used a lot in the management of central nervous system conditions in the country. And then another important thing perhaps to talk about is the issue of carcinogenicity. To say, just because a substance does not acutely cause any symptoms that we know, doesn't necessarily mean that in 20 years' time or in 15 years' time, toxicological effects will not occur. In fact, I was recently in a seminar where it is said that Bruce Ames said over 99% of the carcinogens that we actually know, mutagenic substances, actually emanate from compounds of natural origin. So just because we say, oh, this plant has been used all these years and we've not seen any adverse effects, does not necessarily mean that adverse effects will not occur. So that's why the issue of carcinogenicity also becomes important. And then any other things, to consider. I've just put, carcinogenicity, but then there could be some other long-term effects which can result not necessarily as a result of the plant itself, but as a result of contamination. For example, if you take a plant which is from an area which has got heavy metals like lead or whatever else, whereas the plant itself might not cause toxicity, the contaminants like your lead or perhaps pesticides which may be in the soil, etc., could be the ones which can cause poisoning. And therefore, that's important, bringing me back to that argument that, it's not necessarily that just because something is natural, it's safe. Yes, the plant might be safe in itself, but the contaminants found in the soil may not be safe. So there could be some other long-term effects that occur. So, with regards to the management of poisoning from traditional medicines, I think as you've seen, it's really generic. So, very good supportive and symptomatic therapy is perhaps what is required. And there is need for a meticulous and careful history taking and diagnosis because, like I said, sometimes it might be as a result of a condition becoming worse, and sometimes you might have orthodox medicines actually being involved. And just to reiterate again, very good supportive and symptomatic therapy, maybe what is required, is actually what is required. Looking at whether there is dehydration, then you give you intravenous fluids. If there's pain, you give you analgesics. You make sure all the vitals are good and fine, and then you check for other diagnoses. So really nothing very specific, but things which are quite generic and general. That's what we need to think about in terms of the management. And like I said, concerning the laboratories, you want to take the usual basic lab values, your FBCs, your U&Es, look at the liver function, look at the renal function, and other things like that, so that you can be able to have a proper management. And ladies and gentlemen, that was my presentation on a traditional medicine poisoning, and some references here for you to have a look at. Otherwise, thank you very much for your time, and may God bless you. I look forward to meeting with you during the quiz. Otherwise, thank you so much for your time.